Thank you for inviting me. Thank you to HERE for inviting me today. I want to give a slightly different perspective, and I guess with all the cameras here, it sort of brings my mind back 2 years to when I joined my current organisation, and a trust that I think it's fair to say was under an intense amount of a spotlight at the time. So if I appear shaky, sweaty or whatever, you'll understand why. Okay, if I just tell a little story about Maidstone and Tunbridge Wells, some of you will clearly know about it, or at least will have read about it. What was the problem? Well, the headline problem was high rates of hospital-acquired infection. That led to a very highly critical regulatory report from the Healthcare Commission, in which it had said there were a substantial number of likely deaths that had occurred as a result of that. There was huge publicity around that time, and probably the worst loss of public confidence that certainly I'd ever seen in the NHS up until that point in time. Locally, complete loss of public confidence to a point where people were scared to come into hospital during that period. So, we saw a significant drop in people going to A&E, people wanting to give birth in the hospitals, people turning up for outpatient appointments. That clearly was an appalling situation. Perhaps also staff in denial, staff that certainly felt they'd been victimised, they'd been unfairly treated, and as a result of that, very demotivated. And there wasn't really a sense that it was anything to do with them. It may have been something to do with management, but it wasn't anything to do with them, and they were victims with anything else. Clearly the media coverage was extensive. I try to gloss over this particular page these days. But what were the causes? I mean, clearly in the terms that outbreaks in terms of C. diff were missed. There was a lack of nursing staff, perceived lack of nursing staff, and a real lack of nursing staff. Cleaning was never given a priority within the organisation. I think perhaps interesting, there was a focus on cost reduction. I think subsequently what's been proven, certainly at Maidstone and Tunbridge Wells, and I believe elsewhere as well, is that's a misnomer. The cost of those outbreaks was vastly more than any saving you could possibly have thought of. There were other things around poor antibiotic prescribing and questions over some varieties in microbiological advice. But the real issues behind it were some big cultural issues. There was a climate of fear in the organisation. There was a sense where even quite highly skilled professionals didn't feel that they could contribute and could raise issues with management. And perhaps important for the purpose of this, patient and visitors were not being listened to. There's a huge amount of evidence at Maidstone and Tunbridge Wells that all of these issues were well signalled by patients, by visitors, by groups, well before it actually happened, and they were ignored. So what have we done? Well, I suppose the first thing was looking at an open door policy to any form of interest groups, the press, etc. And I have to say, one of that involved me inviting Panorama into the organisation, which is usually, and seeing David in the audience, a career-limiting move, actually. It can be really difficult, but we felt that we were at a point in time when we'd done a lot more, we'd done an awful lot to make things better, and we wanted Panorama to showcase some of the things that we'd done. I think it's really important in terms of inviting people into the organisation. I think the NHS very much more generally is not very good at selling its stories. Talked earlier about some of the ways in which we use abbreviations and names and overcomplicate things for people. Actually, you really need to get them inside your door, explain why you're doing things, and actually get them on your side. In a previous job that I had, we moved all of our acute services from one hospital to another, which is not usually something that is greeted with cheers from the local establishments. But we did it in a very planned way. We engaged with individual groups. In fact, we engaged with just about any group you could possibly think of, and we won the argument. We didn't necessarily get everyone to say that they agreed with what we were doing, but what they said at the end of that whole consultation process was they understood why we were doing it. They were sold on the clinical case for doing it, but they didn't agree with the decision, and that was usually down to location rather than the actual thing. And I saw that actually as success. Clearly in all of that, there was a need for our organisation in Mason and Tunbridge Wells to show honesty. What the organisation had a reputation for was not being honest and actually pulling the wool over people's eyes. We had to be seen and demonstrably be seen to being honest. We need to engage with all our local partners. Again, a subset of all of this was the relationships with all local partners, be it the local council, local groups, had fallen apart. And indeed, when you have a problem such as a C. diff issue or any other issue, you need your friends at that point in time, and Mason and Tunbridge Wells was severely lacking those at the time. We established our own patient involvement group to actually give a focus to some of that, often representing other groups within that. And we had a non-executive champion. We appointed a non-exec who had a background actually in, she was actually the president of the Royal College of Nursing, had a real interest, had been in cancer services, had a real interest in patient and public involvement, who acted as our champion for that. Clearly all of that would have meant nothing if we hadn't addressed the key issues of healthcare-acquired infections, and I'm pleased to say that we're now one of the cleanest, and with, I believe, I can honestly say in the last 12 months, and it's too many I know, we've only had 3 cases of C. diff that have been transmitted, and you've guaranteed transmission within the hospital. And given where we were, that is no mean achievement. But in all of that, we needed to change the staff culture throughout the organisation, and I'm pleased to hear here as representative of that, which is welcoming dialogue from patients and carers. Actually, we need to listen. We need to listen to patients, listen to what they want. We won't always be able to provide that, but this is not a zero-sum game. This is about actually moving forward with our patients, with carers, in moving forward the organisation. So the key message I just wanted to say is, actually, it's as stark as that. The C. diff scandal at MTW could have been avoided if patients, visitors and our partners had been listened to. Thank you.